When I go inside a patient's home during this COVID pandemic, sometimes there's fear, and how am I going to calm someone's fear? Sometimes that makes me scared as well.
Barb Garretts is a home care nurse, and every day she visits around 10 patients. Today she's come to see Patricia Howard.
Hey Barb, how's it going?
Good, how are you?
Good. Come on in.
Barb has been taking care of Patricia for 4 years.
All right, let's check your blood pressure.
And even though we're in the midst of a pandemic, she still comes twice a week.
I'll get there. There we go.
In fact, because of COVID, Barb says home care is more important than ever.
Patricia needs to be protected, and home is the best place for her. Every time she goes out into the community for an appointment at a cancer center or out for blood work, she's putting herself at risk. You got 122 over 74.
Still a lie.
And so to be able to provide nursing care for her here, to keep her at home for pretty much everything that she needs, is really important. It's her life. Appetite's been okay?
Yeah.
Good. And did you sleep last night?
Yeah. Last night was good. I rely on Barb to keep me home.
And how's the pain control been?
Fantastic.
Good.
To keep me safe. She's my shield against many things out there, not just COVID.
Let me have a look at your leg.
Patricia is 49 years old, 2 kids, and she has cancer. So there are a lot of complications that Barb handles on her visits.
It's there.
Yeah.
So we don't want it to go too far.
Today it looks like Patricia might have an infection in her leg.
Let me see if I can get Dr. Smith on the phone.
Oh, okay.
Rather than leave the house and risk exposure to COVID, they deal with it on the phone.
Oh, hi, Dr. Smith. It's Barb calling from St. Elizabeth Healthcare. Just regarding Pat Howard again. Her right leg does have a little bit of redness to it, so I'm just wondering if we can get her on some antibiotics and get that taken care of.
Barb has been nursing people
Excellent.
in their
Thank you
homes
so
for
much.
20 years.
Bye-bye. We need to have a light shone on us as well.
And she says even now, during the pandemic, home care nurses aren't appreciated.
But we seem to always be the last one to receive anything, be it compensation, be it attention, because people don't know we're here. I think we are the forgotten front line. We're going every day into patients' homes. Patients wouldn't be able to come home from hospital if we weren't here. Patients wouldn't be able to die at home if we weren't here. Just take some nice deep breaths for me.
Barb is one of almost 10,000 home care nurses working in people's homes across the country every day. But here's the thing. They're paid $11 less on average than their hospital colleagues, even though the stakes here are as high as anywhere.
Good.
If I were to get COVID, I have 4-stage cancer, and it's already in my lungs. So it worries me. I don't want to be alone when I die. I want to be surrounded by family. I want to die on my terms.
All right, Pat. Well, today's Monday. Means I'll be back to see you on Friday.
Sounds good.
All right?
Yep. Have a good week, Barb.
Thanks.
Take care.
When I went into community nursing, I realized it was what I was meant to do. It was supporting people. It was teaching people to help them through the worst time of their lives. It's to make it easier for them. Give them a shoulder to lean on when they need it.
When the pandemic started, we focused on hospitals as our response to the virus. But as Barb's visit shows, home care is also an essential tool in the fight against COVID. Nick Purdon, CBC News, Grimsby, Ontario.